of paper two, the most concentrated topic should be Vatavyadi and Pranavahasroto Vikaras. Both have 24 marks each, and all three kinds of questions are expected. Whereas followed by Astimajja Pradoshaja Vikara, we have 14 marks division with all the three MCQ, SAQ, and LAQ. Whereas rest Purisha Vahasrotas, Mutra Vahasrotas, and Udaka Vahasrotas, even though they have MCQ, LAQ, and SAQ, all the concepts, but the marks division is quite less these aspects. So the order of second paper concentration should be of Vatavyadi, then Pranavahasroto Vikaras, followed by Purishavahasroto Dushti, Astimajjavahasroto Dushti, Mutravaha, and Udakavahasrotas. So with this basics of division of marks and what kind of topics you have to concentrate on both the papers for exam preparation in a very lesser period of time. Probably the exam dates are announced in August second week and you have hardly 15 days time. So this is how you have to divide the topics and give your time for which have more marks and which have all the three questions in paper 1 and paper 2. So regarding each topic wise interpretation, what should be done, I'll be dealing from the topic 1. So first in topic 1, as I discussed, it was just 3 marks and MCQ. Concentrate only on Nirukti, Paribhasha, Paryaya, and Bheda of Kaya according to different authors. Make sure, since it is MCQ question, there will be chances of asking the specific Nirukti of Kaya according to specific author. For example, Paryaya of Chikitsa as Chikitsitam, Vyadhiharam, Pathyam, Sathanam, Aushadham. So each individual term of Chikitsa should be defined according to Chakrapani. So what will be the Chikitsa Bheda can be your MCQ question. So Chikitsa Paryaya according to Chakrapani Acharya are dash 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 and dash. Similarly, the different Kaya Chikitsa definitions are there, such as Kayasya Antaragnischa Chikitsa itihi Kaya Chikitsaha, Kaya Chikitsa Nama Sarvanga Samshitanam Vyadhinam Jara Rakta Pitta. It goes on. So which author had stated which Kaya Chikitsa definition and what does it mean? So hardly it takes 3 to 5 minutes to complete this entire topic 1 of paper 1. This is how you have to plan. Next comes topic 2, where you have to concentrate on merely 7 marks. That's it, which constitutes MCQ and SAQ both. So here you have to concentrate on ethical principles. 2 SAQ questions can be think upon or can be expected from this part is explanation of ethical principles and professionalism in clinical practice, or explain effective communication and professionalism in clinic practice, or different codes which has been studied, such as code blue, code brown, etc. That can be asked for SAQ question. Whereas MCQ questions, different section wise divisionalism, such as section ACD consists of which and all concepts. That section wise division should be concentrated here. That can be your MCQ and SAQ questions. So hardly you can give 5 to 7 minutes time for this topic. Next topic comes Samprapti Vihatana, Chikitsa Sutra, Chikitsa, Aushadha Yoga, and Pathya of Jwara. This should be concentrated more in paper 1 because it consists of highest marks, that is around 22 marks, which consists of entire MCQ, SAQ, and LAQ. So what and all concentration should be made here? First, since it is Kaya Chikitsa part, don't forget to write Chikitsa Sutras. Chikitsa Sutra give you maximum marks in both LAQ and SAQ. There will be direct questions from this concept of Jwara in LAQ. So the LAQ questions can be as treatment algorithm for Jwara according to stages of Shatkriya Kala. Second is entire Taruna Jwara Chikitsa, that is Chikitsa Sutra and Chikitsa Yojana in Navajwara. Third LAQ question which you can expect is stages of Sama and Nirama Jwara and its Chikitsa Sutra. Fourth LAQ question is management of Nija Jwara, management of Agantuja Jwara, whereas Dhatu Gata Jwara is quietly asked for SAQ marks, and especially Vishama Jwara and Punaravartaka Jwara can be thought about in LAQ marks. Whereas appropriate Shodhana and Shamana Chikitsa Jwara can be thought for MCQ and SAQ marks, and Daiva Vyapashraya Chikitsa again in MCQ and SAQ marks, which includes Rasayana and construction of Jwara Chikitsa Sutras. So this is about entire Jwara aspect, which concept can be conferred which marks. So for example, I'll take one question where it comprises of describe some describe samprapti vikhatana, chikitsa sutra, chikitsa and aushada of taruna jwara. Be very specific, that don't waste your time writing nidana panchaka in detail. It is not required. Question is very direct, so directly start with Chikitsa Samprapti of Taruna Jwara. Before that, just highlight whichever question is asked directly for LAQ, that is 10 marks. Don't forget to write Nidana Panchaka, but don't keep on wasting time in writing shlokas for that. Nidana can be divided into Aharaja Nidana, any paper 1, 2 or 3 LAQ marks of direct questions to explain Samprapti, Vikhatana, Chikitsa, Sutra, Chikitsa along with Patya. Don't waste your time in Nidana Panchaka. So just divide the Nidanas into 4 aspects. All disorders have Nidanas of Aharaja Nidana, Viharaja Nidana, Manasika Nidana and Panchakarma Apacharaja Nidana. So Nidana of Jwara is already been highlighted. Aharaja Nidana such as Guru, Snigdadi Ahara, Viharaja Nidana such as Guru, Shita Ushnopachara, Manasika Nidana such as Shoka, Chinta, Bhaya, Krodha and Panchakarma Apachara Nidana such as Atiyoga or Ayoga of Vamana and Virechana. This completes your Nidana part. Within 2 minutes you can finish this. Then Purva Rupa, remember 2 or 3 Purva Rupas for each disorders. It is not necessary to by heart the things. If you had already learned, it is well and good. If you are starting to learn from this aspect, don't give much time to by heart Nidana and Purvarupa Lakshanas especially. So remember 4 Purvarupas of Taruna Jwara which has been stated, such as Nayana or Dahaha, Daurbalya, Aruchi, Avipaka. That will be enough. Then Samprapti flowchart is very, very important, because Samprapti Vikhatana is done by means of Samprapti chart. I'll show a PPT of one disorder at the end of the class, that how Samprapti chart should be made and Samprapti Vikhatana should be made. That you can keep it as a base for all the Samprapti flowchart and Samprapti Vikhatana. For example, in Jwara, from where the Samprapti flowchart starts with? Every disorders it starts with Nidana Sevana, Agni Dushti. If there is Ama Pradurbhavata, add Ama Pradurbhavata, then Dosha Prakopa. Pittadi Dosha Prakopa, Vatadi Dosha Prakopa, Kafadi Dosha Prakopa. Or Vata Pradhanya Dosha, Pitta Pradhanya Dvidosha, Kafa Pradhanya Tridosha. After Dosha Prakopa, then there will be Sthana Samshaya Avastha. So Sthana Samshaya to entire Sharira in case of Jwara, then Lakshanotpatti. Same Samprapti flowchart holds good for almost all the disorders, but you should know what happens in each disorder. So don't simply follow the same aspect for Jwara, for Prameha, for Sthaulya. Just remember the flow chart which has been explained in Samhitas. So Samprapti Vikhatana is cutting the Samprapti from Nidana Sevana. So in Nidana Sevana, next itself you can make a chart in your paper. Divide your paper into 2 columns. So one column you will write Samprapti, second column you will write Samprapti Vikhatana. So for Nidana Sevana, common sense is Nidana Parivarjana is Samprapti Vikhatana Chikitsa. Then Agni Mandya or Agni Dushti will happen. So correction of Agni, that is Deepana Pachana, especially in case of Jwara, by means of, give 2 examples such as Amrutottara Kashaya, Chitrakadi Vati, Agni Tundi Vati, which is relevant for that disorder. So you have to know few Shamanaushadhas which is specifically stated for Deepana Pachana in that disorder. Then comes Ama Pradurbhava. If Ama is there, if it is not there, just keep that row of Samprapti. So Ama Hara line of treatment such as Chitrakadi Vati. Next, no need to specify dose, time of administration while you construct Samprapti Vikhatana here. Next comes Pitta Pradhana Tridosha Prakopa. So Pitta Hara Chikitsa by means of Shamana, by means of Shodhana. So mainly you have to remember Shamana Ushadhi Chikitsa and Shodhana Chikitsa, which comprises of one among the Panchakarma. In case of Taruna Jwara, so Shamana Chikitsa you can think about as Amrita Rishta. That will be your Shamana Chikitsa. Shodhana is not indicated in initial phase. Then comes Lakshanotpatti. So Jwara Hara line of treatment. This is generalized Samprapti Vikhatana of Taruna Jwara. Then this is the main part where all the examiners will see is Chikitsa Sutra part. So Taruna Jwara Chikitsa Sutra should be written as Lankhanam Svedanam Kalo Yavagvas Tiktako Rasaha Pachanan Yavipaktanam Doshanam Tarune Jware. So individual aspect of Chikitsa Sutra should be explained while you write. So initially Lankhanam. So what is Lankhana referred here? Whether it is Upavasa, whether it is Chatushprakara Samshuddhi, or it is just light food diet. So here in case of Jwara, it is Laghu Ahara or Upavasa, Lankhanam, by means of Laghu Snigdha Ahara and Vihara. Then comes Svedanam. So what kind of Svedana have been explained here? That is Guru Pravarana Sveda, that is mainly covering yourself with a rug or bedsheet. That is a type of Niragni Sveda that has to be highlighted here. Then Yavagu, different kinds of Yavagu Prayoga, which is Ushna, Snigdha, Jwara, Hara have been highlighted, that should be written. Then Tikta Dravya Prayoga, such as Guduchi Prayoga. Why Tikta Dravya have been highlighted here? It have Jwara, Hara, Deepana, Amapachana line of effect. Then Pachanani avipaktanam. So Pachana Dravya Prayoga should be done. This is the Chikitsa Sutra you have to highlight regarding the Chikitsa Sutra aspect, and Chikitsa Yojana should be made with all these examples. For example, take Yavagu Prayoga, give one Yavagu such as Laja Yavagu with Guduchi Prayoga. Then give few Chikitsa parts which has been highlighted in Taruna Jwara such as Shadanga Paniya Prayoga. That gives you much more marks of 4.5 up to the level of 5 when you highlight these things. Then few Aushadha Yogas such as Amrutottara Kashaya, Amruta Sattva Prayoga, Jwaranta Kaloha Prayoga. So many Shamana Aushadhis are there. You can enlist those. Then Patya Patya, divide your Patya Patya into Aharaja Patya, Viharaja Patya. Again Aharaja Apatya and Viharaja Apatya. So this hardly takes around for one LAQ question 5 minutes to study and to write. So you have to spend at least 5 to 8 minutes to make out the notes. This is the notes how you can make out for LAQ questions. Similarly, if same question have been asked for SAQ question, no need to deliberately highlight what is Langhana, what is Svedana, what is Tiktaka Rasa. In a deeper manner, you just can cut off the few things from that aspects, and no need to highlight the entire Chikitsa Yojana, Patya Patya of a list. So you can write 2 or 3 Patya Patya. LAQ and SAQ questions, plan for LAQ so that in SAQ you can cut short the same thing. Similarly, the MCQ part which you can expect in case of Taruna Jwara is the Chikitsa Yojana made for Taruna Jwara, contraindication of Taruna Jwaras, Lankhana Yogya in case of Taruna Jwara. So all these concepts can be asked for MCQ part. This is one example in case of Jwara Chikitsa, how SAQ, LAQ and MCQ questions should be thought upon. So remember, mainly emphasize on Taruna Jwara Chikitsa, Jeerna Jwara Chikitsa, Sama and Nirama Jwara Chikitsa, Agantuja Jwara Chikitsa, that is Abhishapaja, Abhishangaja, Abhicharaja and Abhigataja. Then especially Vishama Jwara Chikitsa, that is 5 different Kashaya Prayogas which has been given in Santata, Satata, Anye, Dhushka, Tutiyaka, Chaturtaka Yogas, along with a Chikitsa Sutra which has been highlighted for Vishama Jwara. Then individual Dhatugata Jwara Chikitsa and Punaravartaka Jwara Chikitsa. This completes almost Jwara Chikitsa's part with one example of how to write in exam, and which comprises of highest marks here. Then comes next concept of Anukta Roga and the principles of Dosha Dushyadi Vivechana. This doesn't consist of much more points where you can concentrate on SAQ and MCQ. Usually LAQ question doesn't comes from this aspect. So mainly you have to understand Chikitsa Yojana of Anukta Roga, considering the Nidana Panchaka. So few Anukta Rogas, for example, you can take hypertension, which is not directly said in our Ayurvedic classics as hypertension, but you can interpret that as Raktagata Vata, Vata Rakta, Raktavrita Vata. So that can be asked for SAQ. Take an example of Anukta Roga which has been there in modern aspect, but can be brought under different aspects in case of Ayurveda, such as hypertension, hypothyroidism, can be thought in the terms of hypothyroidism as Rasapradoshaja Vikaras, also as Kafaja Pandu, also as Galaganda, also as Gandamala. So that Nidana Panchaka based on the Srotas wise division has to be made. For example, hypertension, if you consider as Anukta Roga, so that can be understood by means of, first you should write definition of hypertension and definition of what is Anukta Roga, which has been explained here, and management principle according to modern, and in Ayurveda how you can understand that. Since in case of hypertension there will be increased blood pressure, that can be brought as Rakta Dushti. So Rakta Pradoshaja Vikara can be taken here, Rakta Vrata Vata can be taken, Rakta Gata Vata can be taken, and Vata Rakta can be taken. So Nidana Sevana, Agnidushti, Vatadi, Vata Pittadi Tridosha Prakopa, then Rasavaha Raktavaha Sroto Dushti, leading to Lakshanotpatti. So similarly, Samprapti Vikhatana should be planned, and Rakta Prasadaka Dravya such as Mahamanjishtari Kashaya, Kaishora Gugulu should be brought under this Chikitsa Yojana of Anukta Rogas. Hardly you can concentrate on MCQ and SAQ from this part. Next comes entirely Sankramika Jwara concept. Again, Sankramika Jwara can be of all three, that is MCQ, SAQ and LAQ. So what sort of questions you can expect here is, describe typhoid according to the means of Ayurvedic Sankramika Jwara Chikitsa, or describe Sankramika Jwara and Kasheruka Jivajanya Vyadhi. So here please remember the coin terms. These coin terms are not there in any Ayurvedic texts, such as Sankramika Jwara, Kasheruka Jivajanya Vyadhi. Since if you are planning to read it for the first time, you feel that it is something from out of the box. But NCISM had given so many coin terms. So remember the coin terms, what coin term have been given in our syllabus for which diseases. They'll directly doesn't ask you to describe zoonotic diseases and write its treatment management. Indirectly they'll ask you that describe Kasheruka Jivajanya Vyadhi and write its Chikitsa Yojana. So don't get confused. Remember, Kasheruka Jivajanya Vyadhi is nothing but zoonotic disorders. So in entire Sankramika Jwara, you have to remember what is the causative organism for specific Jwara, such as zoonotic disease, malaria, typhoid, influenza, pneumonia, and recent concept of COVID-19, H1N1, meningitis, encephalitis, tetanus. All these have specific organisms which is causing this disorder. So don't forget the organism which causes the disorder, and incubation period is very, very important to note down in this. So second thing, don't forget to write the incubation period. Then consider signs and symptoms or clinical features. For example, in typhoid, it is high grade fever, that is high stepping rate of fever in evening. For example, first day if it is 99, second day, especially at an evening times, it rises to 100, then 101, 103 and all. It is called as step ladder increasing of fever. That is expected only in typhoid. Whereas in malaria, there will be continuous fever for 24 hours of about 99 to 100 degree fever. That you have to highlight, which gives you a much more marks. So remember organism factor followed by incubation period and specific what we can consider as Pratyangna Lakshana in Ayurveda. Similarly, specific pattern of fever in all this concept. Then signs and symptoms followed by management protocol. Similarly, Ayurvedic management of this all can be brought under Vishama Jwara Chikitsa, Dhatu Gata Jwara Chikitsa concept, and Jwara Hara line of management. So you have to study modern concept of disorders of all the things in a specific order which had been mentioned. So leptospirosis is one more expected questions in this concept. They can ask anthrax, yellow fever, but remember the coin terms without failure. That is very, very important in this aspect. So next comes the concept of Rasavaha Sroto Vikaras, where one more important topic, which is of 18 marks where MCQ, SAQ and LAQ can be asked, especially in case of Rasa Pradoshaja Vikara, expect Pandu. Pandu is highly asked question in both all the three aspects, MCQ, SAQ and LAQ. So especially You have to learn Chikitsa Sutra of Pandu without failure. And similarly, how I had explained in Navajwara Chikitsa Sutra Samprapti and Vikhatana, and explaining Chikitsa Sutra, that has to be inculcated for Pandu also. Even among Pandu, Mritbhakshana Janya Pandu have been asked many times for 5 marks. So remember Mritbhakshana Janya Pandu, which rasa causes which dosha dushti, what is the Samprapti, what is the Chikitsa. That is very, very important. And few yogas they had highlighted here, such as Navayasa Churna, Tapyadi Loha, Loha Sava, Punarnava Mandura, Dadimadi Krita, and Drakshavalehya. So this can be asked as to write ingredients and indications of these disorders along with Aushadha Sevana, Kala, Matra, and Anupana. Remember which Samhita have highlighted this, because that can be your MCQ question. For example, Tapyadi Loha is highlighted in Charaka, Sushrita, Ashtanga, and Bhava Prakasha can be asked. So remember the yogas which has been stated, learn ingredients and indications. Indication first, all these prime disorders should be Pandu. Along with Pandu, other disorders should be highlighted here. Then one more concept is entire anemia is there in your syllabus. So any hemopoietic values such as the normal range of hemoglobin percentage in women and men, along with MCV, PCV, MCHC, everything should be remembered here. And types of anemia such as nutritional anemia, then hemopoietic anemia, hemolytic anemia, thalassemia. So remember the coin terms again here. Anuvamshika Rakta Vikara. No need to confuse. Anuvamshika Rakta Vikara is directly hemopoietic disorders. So here when they ask, if they ask any modern concepts such as explain etiopathogenesis, diagnosis, treatment of Pandu with special reference to anemia or directly Raktalpata, you have to start with what is anemia, that is definition, then types, pathophysiology, then different hemopoietic values and management. This gives you complete full marks of 3.54 or 4.5 to 5. Then it also have one more basic concept of Hridroga or Hridshula, which is there in Rasavahasroto Vikaras. Again, Hridroga can be expected for LAQ and SAQ both. Remember Prabhakaravati, Hridayarnava Rasa, Arjuna Rishta, Drakshasava, and Nagarjuna Rasa. And mainly, as I explained you in case of Anukta Roga, here directly they had given a Utsa Raktachapa as a synonymous for hypertension and Nyuna Raktachapa for hypotension. So that can be asked. And various disorders which has been highlighted such as coronary artery diseases, angina pectoris, ischemic heart disease, myocardial infection. In case of all Hridrogas, in modern aspect, you have to remember ECG changes in specific disorder. That is very, very important. If you don't write ECG changes, at least ST elevation in myocardial infection or STEMI, non-STEMI, you don't fetch any marks. So highlight on the ECG changes which happens during this disorders along with etiopathogenesis, diagnosis and management in kinds of all modern aspect of Hridroga. Then one more concept that is highly asked in exam is Amavata. So again, entire Amavata from Samanya Amavata Lakshana, Pravruddha Amavata Lakshana and Chikitsa Yojana should be thought about. Again, for example, Amavata Lankanam, Svedanam, Tiktari, Panani, Katonicha, Virechanam, Snehapanam, Bastayas, Chama Marate. So highlight Basti Prayoga in Amavata, which and all Basti Prayogas can be made such as Vaitarana Basti and Kshara Basti. Always remember specialities of that disease. If you don't write Vaitarana and Charabasti and in Amavata, you fetch less marks. I'm not telling you don't fetch marks at all. Since it is exam orientation, your aim is to get distinction. So if you aim for much more, you may get at least near the levels. So that is what your aim should be. So don't forget the specialities such as Vaitarana Basti and Ksharabasti in case of Amavata. And again, few Aushadha yogas have been enlisted such as Panchakola Kvata, Amavatadi Rasa, Ajamodadi Churna, Maharasnadi Kvata, Yogaraja Gugulu, Simhanada Gugulu, Irenda Taila, and Bruhat Saindavadi Taila should be studied. Then one more concept is Madatyaya. Don't forget the stages of Mada, that is Prathama, Dvitiya, Tritiya, and Avasthas of Madatya, which has been explained in classes along with the Aushadha yogas which has been stated. This is about Rasapradoshaja Vikaras. Majorly 4 disorders you have to concentrate on. That is Pandu, then comes Rudroga, then Amavata, and next is mainly Madatya. And next, highest marks again, that is 24 marks in entire paper 1 is of Rakta Pradoshaja Vikara. Here mainly in Rakta Pradoshaja Vikara concentrate on Kamala, especially Kamala Chikitsa have been asked many times for SAQ and LAQ both. So remember Shakha Kamala, Koshta Shakha Kamala. Its Lakshanas are very, very important to distinguish between Shakha Kamala and Koshta Shakha Kamala. So try to remember the Lakshanas of Haridra and Harita, Netra, Twak, Mutrata in one aspect, and one more aspect, that is Tila, Nibha, Varchas. So don't forget these terms. If you forget to write these terms, you'll not fetch with any marks. And Chikitsa Sutra, Tatra Pandva Mayi Snigdha Tikshna Urdhvanu Lomikaihi, Samshodhyam Mrudubhistiktahi, Kamalitu Virechanahi, and it continues to mainly emphasize on Virechana in Kamala. That has to be highlighted. And read Kumbha Kamala, Halimaka. Many times that has been asked for SAQs. So Kumbha Kamala, Halimaka can, and those concepts can be thought about for SAQs and MCQs, whereas LAQ question is completely of Koshtashrita Kamala and Koshtashrita Kamala. And few yogas also should be remembered here, which I had explained like previous disorders. And mainly in modern aspect, remember jaundice. So types of jaundice, that is obstructive jaundice, hemolytic jaundice. So that patterns of post hepatic and pre-hepatic jaundices should be understood. And mainly hepatitis A, B, which hepatitis is infectious, which is not, which is the organism which spreads, that is very, very important. And stages of liver cirrhosis, stage 1, 2 and 3 should be highlighted. And mainly asked questions are at present era, which you can expect is NFALD and NASH, which is highly increasing nowadays. So what is NFALD, what is NASH, definition, the pathophysiology and the management is very, very important here. Then after completing the Kamala, next concept which is highlighted is Rakta Pitta. So remember Rakta Pitta Chikitsa Sutra Akshina Balamamsasya, that is when Stambhana should be done and when Rakta Nirharana should be done is very, very important in case of Rakta Pitta. And don't forget Urdhvaga Rakta Pitta Chikitsa, Adhoga Rakta Pitta Chikitsa and Tiryak Rakta Pitta Chikitsa. Also study the Aushadha Yogas which has been highlighted. And mainly in case of modern aspects of Rakta Pitta, coagulation disorders, hereditary hemophilia, thrombocytopenia, anything can be asked for SAQ. That is quite expected. Then the third important concept is Vata Rakta, in which can be asked for all the 3 aspects, especially LAQ concept. So Samprapti Vikatana, Chikitsa Sutra and Chikitsa Yojana in case of Vata Rakta. Remember Uttana Vata Rakta, Gambhira Vata Rakta, Vataja, Pittaja, Kafaja, Raktaja and Sannipataja Vata Rakta. And it's Chikitsa Sutra, especially highlighting Rakta Mokshana in case of Vata Rakta and Shira Basti Prayogas in case of Vata Rakta. Along with that, don't forget Pinda Taila, many times it has been asked, and Kaishwara Gogula among all the Aushadha Yogas, anything can be asked. And presentation of gout and gouty arthritis, any modern disorders which can be think about is you have to start with definition, then pathophysiology, clinical signs and symptoms, and managements. So especially in case of gouty arthritis, don't forget to write tophi formation. Tophi formation of uric acid crystals is very, very important to highlight in case of gout arthritis. In case of Mada Moksha Sannyasa, usually ask for SAQ and MCQ, so that can be think about. And one more is Visarpa, where entire Visarpa such as Agni Chikitsa, Agni Visarpa, Kardama Visarpa, Granthi Visarpa should be remembered, and its Chikitsa Sutra should be remembered accordingly. And one more very, very, very important aspect in Rakta Pradoshaja is Kushtha. So Kushtha, you can expect any of the Kushta's Lakshanas according to different authors and MCQs, whereas Kushta Chikitsa for LAQ and SAQ both, and individual Mahakushta according to Charaka Samhita, that is Eka Kushta and all in SAQ aspects. So also remember, whenever the Kushta is asked, remember Lakshana is very, very important. For example, Eka Kushta, that is Matsya Shakalopamam, Mahavastum, Asvedanam. So Asvedanam, Mahavastum, Yen Matsya Shakalopamam. If you don't write, you don't fetch marks. So at least write Sanskrit words for everything. Don't write only English aspects. If you just write the condition of Kushta is not sweating in nature, it is present all over the body, instead of getting 2 marks, you will get 0.5 marks. So highlight on Sanskrit terminologies in all the Ayurvedic question answers pattern. So don't forget Asvedana, Matsya Shakalopamam. So that words will fetch you more marks. And Samanya Chikitsa Sutra is very, very important in all disorders. Along with that, next concept which you can expect for LAQ is Shita Pitta Udarda Kota. So this has been highly asked, and differences between Shita Pitta Udarda and Kota for SAQ terminologies also. And modern aspects such as atopic dermatitis, eczema, urticaria, squamous lesion, lichen planus. Just go through it within 5 to 10 minutes. So what is that refers to? What is atopic dermatitis definition? So how does it happen? Clinical features management. That should be your main aspect. And especially in case of Shvitra, don't forget to write Malapurasa Prayoga. That is very, very important to highlight. And a few Aushadha Yogas. This completes entire Rakta Pradoshaja Vikara. So remember the main aspects which can be asked in Rakta Pradoshaja Vikara. The Kushtha mainly, so any kind of Kushtha can be asked. Next Vata Rakta, any question from Utthana Vata Rakta, Gambhira Vata Rakta can be highlighted. Then comes entire Kamala, Kumbha Kamala, Halimaka concepts should be highlighted, and Rakta Pitta. So don't forget this disorders when you study Rakta Vahasroto Vikaras. Then comes Kshudra Rogas. Usually Kshudra Roga is not that highlighted because there is no LAQ question. So you can expect few SAQ and MCQ questions from Kshudra Roga. So remember the Lakshanas of Kshudra Roga according to different authors, and Kshudra Roga mentioned according to different authors for MCQ questions. And SAQ question, it is very easy. Just remember the Lakshana and specific Chikitsa which has been highlighted and under entire Kshudra Roga aspect. And Mamsa Medo Pradoshaja Vikaras, mainly it is here Prameha. So Galaganda, Gandamala and all can come for hardly SAQ and MCQ. So you can expect even Arbuda and Apache for SAQ, but chemotherapy, management of CA, different kinds of tumor markers should be given much more highlighted. Whereas Kasha, Shosha and Sthaulya is highly expected for LAQ. They can ask you directly Chikitsa Sutra and Chikitsa Yojana of Kasha and Sthaulya together, or they can ask Shosha and Kasha separately along with Sthaulya. And Prameha is very, very important here. So learn Chikitsa Sutras of all the disorders. That is very, very important. That is Stula Pramehi Balavani Hekaha. So Stula Pramehi Chikitsa and Krisha Pramehi Chikitsa should be highlighted. So everywhere you had seen stages of Shat Kriya Kala. So starting from Sanjaya, Prakopa, Prasara, Sthana, Samshaya, Vekta, Bheda, Avastha. So how Shat Kriya Kala should be highlighted will be thought here. So I'll be giving one example of Prameha. So it's easy to remember and write in exam. For example, they had asked Samprapti Vikhatana, Chikitsa Sutra and Chikitsa Yojana along with Pathya of Prameha. This is how I had said you to divide the entire paper into two aspects, that is column wise. So first it comes Nidana Sevana, that is you have to highlight Asya Sukham, Swapna Sukham. No need to write that is so shloka what has been highlighted. Just you can interpret the terms. So Nidana Sevana such as Asya Sukham, Swapna Sukham, immediately you have to write Nidana Parivarjana there. Next, what happens there? Initially Kapha Prakopa happens leading to Mamsa, Meda, Shariraja, Kleda, Dushti at the level of basti, that is Kafaja Prameha happens. So here the line of treatment should be Kafa Mamsa Medohara Chikitsa such as Asanadi Kashaya, Tifala Prayoga, Sarvanga Udvartana and Churnapinda Sweda Prayogas. Next, what happens if Kafa Prameha Upekshana have been done along with Ushnadi Pitta Prakopaka Nidana Sevana, then Pittaja Prameha happens. So Pittaja and Prameha Hara Chikitsa such as by means of Chandanasava, Nishamalaki Prayoga, Sarvanga Mustamalaka Takradhara should be highlighted. Then again the next concept is Kafaja Pittaja Prameha Upekshana along with Rukshadi Vata Prakopaka Nidana Sevana, which affects also Majja, Lasika, Ojas, leads to Vataja Prameha. So immediately you have to write Vata Prameha Hara Chikitsa such as Chandra Prabhavati, Sarvanga Utsadana and Patrapinda Sveda. So this is about how you will write the Samprapti chart, that is Nidana Sevana, Kafa Prakopa, then Kafa Pitta Prakopa, Kafa Vata Prakopa, that is Kafaja Prameha, Pittaja Prameha and Vataja Prameha. So immediately you will write Nidana Parivarjana, Kafa Mamsa Medohara Chikitsa, then Pittaja Prameha Hara Chikitsa and Vataja Prameha Hara Chikitsa. And don't forget to write Pratyatma Lakshana of any Vyadi which has been asked. For example, in Prameha, Tatra Avila Prabhuta Mutra Lakshanaha Sarva Eva Prameha Bhavanti. So Avila and Prabhuta Mutrata should be highlighted. And as I said, Sthula Pramehi Balavani Heka Krishasataika Paridurbalascha Sambrumhanam Tatra Krishasya Karyam Samshodhanam Dosha Bladikasya. So this should be highlighted here as Chikitsa Sutra. And individual Kafa Pittaja Prameha Chikitsa, remember Samshodhana, Ullekhana, Lankhana Prayoga. In case of Vataja Prayoga, different kinds of Tailakrita Prayogas. And Patya by means of Aharaja, Vitaraja should be highlighted in case of one disorder. So this is what an example of Samprapti Vikhatana, Chikitsa Sutra and Chikitsa Yojana. So many times when we had seen the contents, we had seen treatment algorithm along with stages of Shatkriya Kala. This is one example I am highlighting here. This should be adopted for all other disorders. Shatkriya Kala is very simple. Sanchaya, Prakopa, Prasara, Sthana, Samshaya, Vikta and Bhedavastha. So what does the treatment algorithm of any disease should consist of? Nidana Parivarjana, simple Patya, Vyayama, followed by, this is pertaining to Prameha where I had highlighted Vyayama, whereas in other disorders it will be Nidana Parivarjana, Patya, then Shamana and Shodhana Chikitsa based on Vyadhi Avastha. So initially Sanchaya, what happens in case of Prameha? Kapha Sanchaya happens because of Asya Sukha, Swapna Sukha, Dadhyadi. So the Swasthanataha Kapha Prakopa lead to Minindradhikya. Kaphasthanas, so Ura, Kanta, so that are Kaphasthanas. What should be that line of treatment? Nidana Parivarjana, Pathya and Vyayama. That's all in case of Sanchaya Avastha. In case of Prakopa, what happens? Kapha Prakopa takes place in Swasthana, its sthana itself, leading to Atmana, Gauravata, etc. So here, along with Nidana Parivarjana, Pathya and Vyayama, Apatarpana Chikitsa should be concentrated upon. Whereas next stage is Prasara Avastha, where Kapha Prasara to other sthanas, that is Kavairunya, Sarvanga Gaurava will be there. So Nidana Parivarjana, Pathya, Vyayama in an intense phase along with Apatarpana Chikitsa should be highlighted. Sthana Samshaya specifically to Mamsa, Meda and Mutravaha Srotas, that is Prameha Purvarupa Avastha, such as Chitali Bhava Keshe, Madhurya Masyata and so on. So here Nidana Parivarjana, Pathya, Vyayama, Apatarpana and Shamana Chikitsa should be adopted. And final stage is Vyaktavastha, that is Lakshanotpatti, where Kafaja Prameha Rupa Utpatti happens. You have to add Shodhana along with all the other line of treatment. And at last it is Bheda Avastha. So Vyaktavastha can be divided in three phases in Prameha, because there will be Kafaja Prameha Utpatti, Pittaja Prameha Utpatti and Vataja Prameha Utpatti. Similarly, in case of Kafaja Prameha, Shamana and Shodhana of Kafahara. In case of Pittaja, Pittahara line of treatment and Vataja, Vatahara line of treatment should be adopted. And Bhedavastha, remember Prameha Pidaka and Prameha Upadravas, which has been highlighted, such as Sharavika, Kachapika, Jalini and all. So here, along with Shamana and Shodhana, immediate emergency line of treatment should be adopted, such as Pranaropana, Shodhana line of treatment. This is one example which I can give in a very small amount of time of how to do Samprapti Vikhatana by following the Samprapti flow chart and immediately Vikatana, and how to write Shadkriya Kala. So whenever Shadkriya Kala of any disease is asked, just highlight Sanchaya Prakopa Prasara Sthana Samshaya Vyakta Bheda Avastha, which dosha is highly predominant with Lakshana and Chikitsa. This is how the treatment algorithm should be made of any disorder. So this is an example of Prameha which I had taken here. So next, in case of Mamsa Medo Vahasrota, similarly Sthaulya can be thought upon, and a few modern concepts such as obesity, dyslipidemia can be understood over here. Then comes Shuddha Ashuddha Chikitsa, where Shuddha Ashuddha Chikitsa is of very least importance, such as MCQ and SAQ can be asked. So you can just understand what is iatrogenic disease and how that is caused, whether it is doctor induced or hospital induced, that should be understood here. So this completes entire paper 1. Immediately the paper 2 concept of Vata Vyadhi should be thought upon. In case of entire Vata Vyadhi, concentrate on Nirupastambhita Vata Vyadhi Chikitsa, which consists of Snehana Svedana, and Upastambhita Vata Vyadhi Chikitsa, which consists of Mridu Shodhana, Niruha Basti Prayoga, Nasya and Dhumapana Prayoga. And individual Vata Vyadhi which has been highlighted in your syllabus, such as Akshepaka, Pakshaghata, Sarvanga Vata, Ekanga Vata, and different stambhas, that is Manya Stambha, Jihva Stambha, and Vishvachi, Apabahuka, and lower limb disorders such as Gridrasi, Khaldi, Khanja, Pangu, Kalaya, Khanja. So including Udavarta, Urastamba, and such disorders such as GB syndrome, motor neuron disorders, everywhere where Vata Vyadhi will be asked for compulsorily LAQ and SAQ. Don't forget this entire Vata Vyadhi concept. Remember Chikitsa Sutra. Chikitsa Sutra is very, very important in individual Vata Vyadhi. For example, Pakshagata, Snehanam Sveda Samyuktam, Pakshagata Virechan. If you don't write that, there will be no marks at all. So in case of Grudrasi, Antara, Kandara, Gulfa, Sira, Bastyagni, Karmacha, if you don't highlight on that, no marks will be given. So mainly concentrate on Chikitsa Sutras in case of all the Vata Vyadhis, and mainly concentrate in modern aspect of stroke, different kinds of stroke, hemorrhagic stroke, ischemic stroke, and mainly the concepts of Ardhita, that is facial palsy, Bell's palsy, paralysis, and mainly sciatica, cervical spondylitis, and cervical radiculopathy can be asked in your exams. In case of Asthimajavha Srotovikaras, mainly remember regarding Asthik Shaya and Asthi Saushirya. So Asthik Shaya have been highlighted in Samhitas, and Asthi Saushirya have been highlighted as Majjak Shaya. So remember that along with Sandhigata Vata, osteoarthritis, osteopenia, osteoporosis are highly asked questions in case of Asthimajavha Srotovikaras. So then comes concept of Pranavaha Srota Vikaras, which is high importance along with Vata Vyadhi in your paper 2. So Vata Vyadhi and Pranavaha Srota Dushti Vikaras have equal sharing of marks of 24 each. So remember Kasa, Shwasa, Hika, Raja Yakshma in an order. So highly asked question is Tamaka Shwasa and Chikitsa of Shwasa for LAQ. Along with the types here, mainly concentrate on types of Kasa, Shwasa, and Hika. Many times that has been asked in exam, that you should not forget the names at least. Lakshanas can be just highlighted, no need to bahad the shlokas, but Tamaka Shwasa, don't forget this. And especially when Shwasa Roga have been asked, simply don't write Kasine Chadanam Dadya, Swaramangecha Buddhiman, Vata Shreshma Haraidukte, Tamaketu Videchanam. That doesn't give only you the marks, that is just a part of your Chikitsa Yojana. Start with Aktam Lavana Tailena, Nadi Prastara, Sankaraihi. So Hika Shwasaditam. That is your actual line of treatment. So remember, concentrate on Nadi Sweda, Prastara Sweda, then following the Vamana. No need to by heart shloka, but at least first 2 lines of Hika Shwasaditam, that should be highlighted. Then along with that, you can highlight the Tamaketu Virechana. Remember Santamaka and Pratamaka phases of Tamaka Shwasa, especially in case of Shwasa. In case of Kasa, Kshayaja and Shataja Kasa have been many times asked for SAQ, and any other Kasa Chikitsa can be asked. And again, Hika, entire Hika can be asked for SAQ and LAQ as such. And Raja Yakshma, don't forget Rupa and Shadrupas of Raja Yakshma, and Ekadasha Rupa, that is very, very important. And Samanya Chikitsa of Raja Yakshma. And Urakshata is also can be asked for MCQ and SAQ as such. So this is mainly about Pranavaha Srotas. which consists of much more importance, and which concept should be highlighted is very, very important in case of Pranavaha Sroto Vikaras. And in case of Udakavaha Srotas, mainly asked question is Udara. So Trishna and Shotha will be asked mainly for SAQ and MCQ. So concentrate much more on Udara, especially in case of Udara, don't forget to write Nitya Rechana. So few concepts are very much important, and Trishna types, it is different according to different authors. So don't forget, and especially different kinds of Jala Prayogas in Trishna, that is Shuta Shita Jala Prayoga, Shitala Jala Prayoga, then Antar Jala Prayoga, that is very, very important that you just go through it. And Shota Hara line of treatment, mainly Ama Shofa, Pachamana Shofa and Pakva Shofa should be highlighted here as of Ama Pakveshaniya Shotha Dhyaya, and types of Shota such as Vataja, Pittaja, Kafaja should be taught, and Samanya Shota Chikitsa should be concentrated on, and mainly Jalodara should be concentrated upon in case of Udara Roga. Many times it has been asked for LAQ and SAQ. So don't forget Nitya Shodhana or Nitya Virechana in case of Jalodara, along with surgical aspect which has been said. And types of Udara have been asked many times, that is Chikitsa part in SAQ questions. This is about Udaka Vahasroto Vikaras. Then comes mainly, especially in case of modern aspect, CKD, nephritis, AKD, just go through it. Don't forget those aspects. Then in case of Purisha Sroto Vikaras, give most importance to Atisara and Grahani. Many times it has been asked. And especially in case of Krimi Roga, remember Nidana Parivarjana, Apakarshana and Prakriti Vikhatana. Don't forget to highlight these terms. And few yogas have been highlighted here under Krimi, under Atisara. And that should be remembered. And Grahani, that is very, very important. Then Annavaha Sroto Vikara start from paper 3. So paper 3 will be dealt in one more class. So this is a gist of entire paper 1 and paper 2, along with how much marks is there for which srotas and how much importance should be given, along with few examples of SAQ, LAQ and MCQ. So now it is open for discussion. If you have any questions that if I had not highlighted in this presentation, you can ask me related to exam part. Open for question and answers.
Students, if you have any doubt, you can ask.
So in case of Gatavata, you can expect high questions from Sandhi Gatavata, as it is direct part of Astimaja Vahasroto Vikaras, and Snayu Gatavata, which is directly there in your syllabus as Sandhi Gatavata for LAQ and Snayu Gatavata for SAQ. Whereas other Gatavatas such as Astimaja Gatavata and Mamsa Medo Gatavata have been asked many times in exams. So just you have to know which Lakshana have been given from which authors, because MCQ questions is most appreciable in case of Gatavata questions, and what kind of treatment have been highlighted. That will be enough.
Modern topics are in DK, so will they be asked in LAQ?
So you have already experienced in RSBK and DG what has happened. Don't forget DK, MK, NK here. So keep that aside. Read based on the marks distribution. Even after experiencing such a vast, disastrous question paper in second year, if you are still relying on DK, NK, I think that is not the best way.
Next question is Chikitsa Sutra Pratisara. How to write Chikitsa Sutra Pratisara?
So any disorder, as I said, if they ask Chikitsa part, start from Samprapti Vikhatana, write Samprapti chart, do Vikhatana there and them itself, and write Chikitsa Sutra, especially for Amatisara and Pramathya in case of Amatisara, Laghubhojana, then Stambhana should not be done. So highlight the different aspects which has been stated there. That is very, very important.
Next question, madam. Psoriasis is important.
Of course, yes, because many times it has been asked in SAQ and LAQ both. So remember the definition of psoriasis along with its types and management.
Any other questions?
Okay, one more is there in chat box. Like we write posology to, should we write posology to all Chikitsa Yoga? Not necessary, since it is not practical examination. We don't expect students to write posology. For example, Amrita Rishta 10 ml thrice a day after food or before food. Usually we don't expect it. Even if you write it, that's fine, but better not to write, because for each individual the dosage changes. So just highlight the Aushadha yogas which have been given in your syllabus. That will be enough.
And that part will be there. Session will be there. Don't worry. And ma'am, any Ayurvedic LAQ questions writing brief modern part is necessary. And what about in SAQ?
If question is directly Ayurvedic part, no need to highlight any modern aspect. But if you write modern aspect of just what does can be interpreted to. For example, a direct question is like explain Chikitsa Yojana and do Samprapti Vikatana of Kushta. We don't expect you to write any psoriasis in that question. So if you just highlight few conditions which can comes under Kushta, that is fine. That is just an extra. Even if you write, even if you don't write, you will get full marks. Same in SAQ. If there is no direct question, don't break your head writing nonsense things.
Another question, madam. Formulations are formats asked separately? Formulations.
One formulation is not asked, but there can be a question from SAQ stating that write ingredients and indications of 4 or 5 formulations, which can fetch you the complete marks.
Question, madam. Ma'am, in case of coin terms, how to present answers?
Present answer whichever it is there. For example, as I said, typhoid, they had given some coin term. They'll ask you the coin term, right? This coin term is confined to typhoid, write about typhoid. At last, write Ayurvedic management for it. That's all.
Second question also have same meaning, I think so. Will modern name will be given or just coin term will be given in modern questions? I think same.
Both can be asked because you are the first batch, so we can expect anything.
Another question, madam. Ma'am, in case of modern disease, given along with treatment of modern and the Ayurveda. In that case, ma'am, Ayurvedic treatment should be explained in detail or just to write Chikitsa Sutra and the Shramana Aushadhi enough?
If the question is directly a modern disorder, just highlight Chikitsa Sutra and Shamana Aushadhi. If the question is Ayurvedic disorder, you have to write in detail.
Another question, madam. So, in Samkramika Jwara and Ksherunaka, should we write Ayurveda or modern?
If there's Sankramika Jwara and Kasheruka Jwara, whether these terms have explained in Samhitas? No. So since there is no direct explanation of these terms, there is a bracket which has been given. So write whatever is there in modern aspect detailedly and highlight Chikitsa Sutra and Chikitsa Yojana in Ayurvedic aspect.
And the Mutra, Shrotas and the Kshudra comes in second part or third part? Madam?
It comes in paper 2.
Okay. What about they ask questions?
I had highlighted. So Kshudra Roga, they can ask SAQ and MCQ. Even in Mutra Srotas, all the 3 aspects can be highlighted. Ashmari.
Shall I speak? Yeah. Continue.
Yeah. So the disorders which has been highlighted in that will be in paper 3. So I had not touched the paper 3 concepts. That will be dealt in other class.
Yeah, paper 3 will be dealt by another doctor.
From Annavaha Srotas, rest all topics will be covered in that class.
Ma'am, can you explain how to present answer of regarding Samprapti Vibhagatana Chikitsa for disease?
That only I had explained in my entire PPT, taking example of Prameha, follow the same order. And
ma'am, do we have to ingredients for formulation? And it's given only Parashruti, Aushadha Sevana Kala and Anupanas and dose.
Without writing ingredients, you don't expect marks, dear. At least 2 to 3 ingredients is must. We don't
Um,
expect you to write entire RSBK concept of 20 ingredients. At least main ingredients in a formulation of 2 to 3 is must.
Ma'am, mostly which type of Kshudrayoga is asked?
Anything can be asked. I am not a question paper setter. So please read once everything.
Thank you, madam. Thank you for your giving your valuable time for our students and for Ayurreshmi. Thank you so much for your presentation, madam. Our students, I think our students are happy and they have cleared their doubts. Thank you so much, madam.
Thank you so much for the opportunity, sir. Thank you.
Thank you, madam. Thank you, students. Let we end up the session. Tomorrow we meet in another session. Thank you so much. All the best. Thank you.
All the best for your exams.